welcome back to another video. So in this video, we'll be discussing another popular condition, which is diabetes mellitus type 2. With diabetes mellitus type 2, it is considered a presumptive condition. And so what does that mean? If you're served in Vietnam and you have exposure to herbicides or Agent Orange, you may be eligible for compensation based on herbicide exposure. That's 38 CFR 3.309. Now, diabetes mellitus. In today's video, I have Dr. Nguyen with me, who serves as our main medical doctor here in the firm. She is the brains behind putting the cases together from a medical standpoint to make sure the VA will agree with what we're presenting as a firm. And so with that being said, diabetes mellitus, what is diabetes mellitus? How do veterans get this condition, and what are some symptoms they may suffer from?
Yeah, so diabetes, very common in the normal population and our veterans. So diabetes refers to actually a group of diseases that affect how your body uses blood sugar, also known as glucose, and result in your blood sugar being too high because your body cannot use the glucose in the blood. And then you have the health problems as a consequence of having too much sugar circulating in your blood. So there's type 1 diabetes, which presents in childhood or adolescence, and then the more common in our veterans and in population is type 2, presents in those over the age of 40 usually. There's also prediabetes, which is a precursor to diabetes, and then gestational diabetes, which does often resolve once the baby is delivered. So insulin essentially is a hormone that comes from a gland underneath the stomach from the pancreas. The pancreas secretes insulin, which allows the cells to actually take up the blood glucose. Without enough insulin, then the cells cannot use the blood sugar, and so it actually increases in the circulating blood and goes to other parts of your body and damages various vessels, nerves, and that's kind of where you see all the symptoms. So you can start to see some symptoms in both type 1 and type 2 diabetes presenting as increased thirst. Frequent urination, because you have so much of the sugar in your blood that you're drinking more water to dilute it, just your body's way of compensating, and then you're urinating that water out. Extreme hunger, you can have unexplained weight loss. Ketones in your urine as a result of breakdown of muscle and fat because you cannot use glucose. And then unexplained weight loss is mentioned. Fatigue, you can be irritable because of the high sugar, blurred vision, damage your retina from the sugar. Slow healing, frequent infections, a lot of wounds, so it affects your life tremendously.
Wow. So not only does it affect your life tremendously, but it causes a host of different symptoms. And so from a rating standpoint, how do we actually get service connection for this, and which symptoms are required to get different levels of percentage? And so on our screen here, we have the different levels of percentage for diabetes mellitus type 2. It starts off at the low end of 10%, then it rates at 20, 40, 60, and up to 100%. At the 100%, there's a requirement of more than one daily injection of insulin, a restricted diet, and regulation of activities, which means avoidance of strenuous occupational and recreational activities. There also could be episodes of ketoacidosis or hypoglycemic reactions requiring at least 3 hospitalizations per year or weekly visits to a diabetic care provider. Those particular symptoms equates to a 100% VA disability rating. At the next lower evaluation is 60%, which is requiring 1 or more daily injections of insulin, restricted diet, and regulation of activities with episodes of ketoacidosis or hypoglycemic reactions requiring 1 or 2 hospitalizations per year or twice a month visit to diabetic care provider. Now the next evaluation below that is 40%, then 20% and 10%, and as you can see here at the lowest end of 10%, it's manageable by a restricted daily diet. And so in today's conversation, we discussed diabetes mellitus type 2. As a recap, it is considered a presumptive condition. And so if you have service in Vietnam, or if you've been exposed to herbicides or Agent Orange because of your Vietnam service, you may be entitled to compensation for diabetes mellitus type 2 if you have these conditions. More importantly, what we need to win is evidence of military service. We need also a DD Form 214 if it's based on a presumptive condition of Vietnam activity, meaning you've been deployed to Vietnam and had exposure to both brown and blue waters now. The VA recently made an adjustment in their policy regarding the exposure to brown and blue waters. So if you're a veteran, you served in Vietnam, you have these symptoms and you have a diagnosis, more than likely we can get it service connected on a direct service basis because of your military service. So once again, guys and girls out there, thank you so much for joining us. Let's win your VA claim.